One thing that the relational triads approach does is bring something that can feel pretty huge when you're a clinician into a kind of concrete, operationalizable format. So, if you're a clinician and you're used to sort of saying, oh, your review of systems very concrete. Does your knee hurt? Does your toe hurt? How are your allergy symptoms? And then now we're suddenly taking on something like, what are all of your difficult life experiences and how have they affected you? It can feel kind of overwhelming, I think, to bring in this element, especially because we've so traditionally kind of separated mental and physical health, and we know we're not mental health professionals. If you're thinking about trying to screen for ACEs and you're thinking, okay, I need like the 4 R's from SAMHSA and I need the 7 principles of trauma-informed care, how to bring that into a conversation is actually pretty challenging, but they're actually kind of baked into TRIADS, and it's just 3 elements that really help you connect with your patient in an empathic, strengths-based way, and bring these things that the patient's carrying with them that affect their health into the clinical encounter. So just kind of what happened, how did it affect you, and how, and what helps. Those 3 elements, they're easy to remember, and if you go through them, you'll be having a conversation with your patient that really brings in the principles of trauma-informed care into your clinical encounter in a way that can be a conversation that makes sense in the kind of visits that we have. Patients are carrying the weight of their experiences in adversity and trauma. It's not news to them that feels heavy. So having a safe, trusting container for that, or being able to share that, to speak the unspeakable in a way that's not overwhelming to the provider, that burden is suddenly diffused a little bit for them. And it's pretty profound just having it come to light and having it be something that's allowed in, that's such a big part of their life that's now allowed into the exam room, is pretty profound. So having this kind of simple stepwise way to offer a container for our patients where it's not overwhelming for us because it's simple and stepwise. We've normalized it for them. We've opened the door, and now we're holding it in a way that we're very comfortable with because it is straightforward. You can tell that it's unburdening to them, that it feels great for them to be able to share what's happened to them with the person that's trying to take care of their health. There was another patient who I screened for ACEs, and this patient had an ACE score of 6. She had had significant adversity and kind of continued to suffer from a lot of challenges related to social determinants of health and mental health challenges. And I think having this be kind of a normalized clinical part of our conversation just really brought, sort of opened the door to bring all of those elements that she was struggling with on a day-to-day basis into our conversations, and we of course did case management with her, working on addressing all of those things, but she was able to share with me things that were really weighing heavily on her, like, my biggest fear is that I'm going to pass on these mental health challenges that I have that I know came from my childhood, and my biggest fear is that I'm going to pass those on to my child. And just number one, being able to have someone else, kind of share that fear and have it reflected back to you, not as, oh my gosh, you're right, this is such a disaster, but yeah, of course you feel that way, and there are things that you are already doing that help diffuse the effects of your situation on your family. The fact that you're getting support, the fact that you're in treatment for your mental health conditions, the fact that you have this team of people kind of watching out for you and supporting you is helping prevent that, and it feels sad to me to imagine a scenario where she would be carrying this biggest fear and we wouldn't be talking about it, because my job is to support her. I've been surprised by how little extra time this takes, especially compared to sort of the enhancement in the relationship and communication that comes down the line. It's kind of you don't have to be a therapist to be therapeutic. That's true. And if you have a framework like this, you can actually talk about these things with your patients, and it makes a big difference.